Here we go. Um, Federal government shutdown. We are not affected as an AmeriCorps program. So the way our funding works is it's already at the state level, so we're not dependent on money to come straight from the federal government. So we'll continue to be able to pay everybody as usual. No impacts there. But recognizing that there are impacts for our members that might utilize benefits like SNAP or WIC or anything else that's reliant on federal government housing assistance. So this can also obviously affect the folks that you're serving at your health department. So if there are resources that are in your community that are better than some of like statewide resources that are going out. Sometimes those lists aren't great because they don't encompass the organizations that are doing the bulk of the good work in your local community. So I haven't shared a couple of resources that have come down because as I looked through them, I always look at the ones that I'm familiar with. I look at the locations I'm familiar with. And there was one that came down. Um, and it was a national list, and you could break it down by your city, by your zip code. And I'm most familiar with the ones in Fayette County and Lexington. And the nonprofit organization that is currently doing the most in Lexington was not even listed. So I get hesitant to share those types of lists. So I just want to make sure that if you all have good resources, because we're spread out across the state, please share those with me and I can pass those on. And then on the flip side, if you are struggling right now and you don't have a good um, source to reach out to help yourself or your family, please let me know. I would hate to think about one of our members in our program not being able to access something. So let's work together. You hopefully have my cell phone. I'm gonna make sure that I include that when I do my follow-up today. I've got some additional resources that I will include in our follow-up today. I just want to make sure that this we're acknowledging that this is uncharted territory for us as an AmeriCorps group and also just as a state, as a nation, all those things. So let us know if by us, I mean your site supervisor, fellow members, me, whoever you're comfortable with reaching out to ask for resources or ways we can help. Um, if you want to type resources in the chat while we're going through today, that's great. I'll compile them and share those out if you feel like that's helpful. Any questions, comments before I move on? Okay. Um, I, I wanted to keep the America Learns data review on here just in case anybody had questions, but I feel like we're getting through some things. And as I'm doing my site visits, I'm making sure that we are kind of checking in and going over things. But I feel like folks are doing a good job. So I am reviewing your data each week that you're submitting. If you have any issues, any questions, continue to reach out. And if I send something back, if I send your progress report back, I am going to include what needs to be fixed. But there not any like big red flags that I'm seeing. So I haven't reviewed this week's data that just got submitted, so you might get something sent back to you. But typically, what I'm seeing is the numbers that you're saying you're served aren't matching the numbers that are the number of people that are included. So you're just forgetting to go in to the scrolling all the way over and click add new person. So that's the most common issue that I'm seeing. Is anybody have any questions, any issues about their America Learns data submissions or report right now? And I see Alina has shared a Madison County resource. That's helpful. A local blank applications for a local food resource that can deliver if folks have transportation issues. So, no, that can sometimes be a really big barrier for our communities that it's not easy to get around. So, thank you for sharing about that in Madison County. Sorry, I'm jumping around a little bit. Any questions about America Learns? Any issues that anybody wants to bounce off anybody right now? And you can always follow up with me one-on-one too. Okay, everything's going swimmingly with America Learns. I love it. And Noah and Cornisha, don't you haven't had to submit your first one yet, so don't worry about it. It's going to be great when you do. Wanted to go over some upcoming dates. If you are a first year member and you have not completed your CHW training, I don't know that we're going to have another opportunity before 2026 to do a training. So I'll keep you posted if that changes. If it is going to happen, it would be in December. So I'll give you as much lead time as I can. And for our Louisville area members, we're still waiting to see if there's going to be a free training. If that free training happens, that one I do anticipate being before the end of 2026, but still just kind of waiting on our trainers to give us an update there. I mentioned in-person site visits before. For our folks that have gone through that already, I just meet with you one-on-one, meet with your supervisor one-on-one, take a quick tour of your health department. If I haven't been there before, if I've been there before, I might not need to do that. But I have not been to all health departments before. And then we'll meet together as a group if we need to. So, holiday season is upon us. We had Halloween. Hope everybody had a good Halloween. Not that that's a recognized holiday. For some of us, it might be. I love Halloween. We've got Veterans Day next Tuesday. So, I believe all health departments are closed. It is a day off for me, for my office. So, if it's a day off for your health department for it being closed, obviously take it off. Thanksgiving Day and the day after Thanksgiving your health department should be closed. So the next holidays are probably not going to line up with what your health department takes off. So, just some quick notes to take away. Excuse me, your member service agreement outlines the days that you have available off to you. And those are December 24th and 25th, December 31st, and January 1st. So your health department is probably following the um, days off that state workers take off. And it's going to be, I believe, the 25th and the 26th, and January 1st and January 2nd. So it is your choice if you would like to take off the days that your health department is closed and if you'd like to serve on the days that they're open, but you don't have to. Obviously, you can't serve on a day at the health department if they're closed. So you would essentially get an extra day off. Now, what I think you need to think about is, do you have the hours that will support you taking an extra day off? Do you have the hours that will support you taking more days off around that time? And are you checking in with your site supervisor and me to make sure that this is okay for you to take additional days off? So, think about this. You don't have to decide it right now. We're at the beginning of November, obviously. Um, America Learns does a great job of telling you how many hours you've got that you need to complete each week to finish on time. So I would expect some folks to take time off around the holidays. Just try to keep track, and we'll be talking about it as I do my site visits and as I check in with you. Any questions about time off? The last thing to remember is that you do have to serve some amount of time during your 2 week period between the 1st and the 15th and the 16th and the 30th to get paid. If you are not serving any time at all, you will not earn a paycheck. So remember that. That's important to keep in mind as you're thinking about your holiday schedule. Any questions, comments about holidays? Okay. Um, Martin Luther King Day of Service will be here before we know it. So this is, if you're a returning member, you recall that this is a day on for AmeriCorps members. If this is your first year, hopefully this isn't news because you've looked through your member service agreement. Um, but here's where you've got to do a little bit of extra prep for this day because your health department is closed on MLK Day. It is a holiday for everyone else. But for us, it's a day on. So your little bit of homework here is to start thinking about a service activity that you can do for MLK Day. Um, I'm going to ask our returning members that were here last year, if you wouldn't mind typing in the chat a couple, what you did last year. I will also preface MLK Day, without fail, is always a bad weather day. So, we've kind of, a lot of our AmeriCorps programs that are either statewide or regional have kind of given up on trying to organize where you have to travel. So, try to stay within a close proximity to your home or to your service site so that you don't have to travel because it's going to snow that day, I guarantee you, or it's going to be bad weather. So, so Alina made hygiene kits for our folks that were close to Frankfurt. We partnered with the Homeless and Housing Coalition, their AmeriCorps program, to put together care kits for folks experiencing homelessness. So we kind of did a big assembly line and put together those kits, and they kept those kits there and hand them out throughout the winter season. Um, I think we had some, I'm gonna see who typed in here. Latoya and Lexington participated in the Lexington festivities, made breakfast, and then walked in the parade that afternoon. I think Lauren over in Western Kentucky volunteered at a senior center that morning with the folks that live there. So this is kind of open-ended, but I do want to know what you're doing. So think about it. It doesn't have to last the whole day. I don't expect you to do something that is 8 hours long. But think about what you're doing. I'll send you some reminders, but come prepared to December's monthly check-in with what your thoughts and plans are for MLK Day of Service in January. So it's towards the end of January, so we got some time, but it seems like once we hit this holiday season, time doesn't happen in the same way and it just moves really quickly. So, any questions, thoughts about MLK Day? Okay. A quick reminder about America Learns documents. If you have not, if you and or your site supervisor have not completed these, let me know. If your site supervisor needs a reminder, I'll push them. I didn't realize I did a site visit this week and didn't realize that the site supervisor hadn't signed these, and they have to sign them first before you can. So thank you for helping me to make sure that all our documents are up to date before we go through our audit with our State Service Commission. Okay, I'm going to go over a benefit that is available to you as an AmeriCorps member. I'm gonna swap my screen really quickly. Can't see anything. Do you all see the dumb screen or the big screen? Like the screen with the click for notes screen? Okay. Now do you see the big screen? Okay, thank you, Craig. All right. Okay, so this benefit is something that is new for our program this year. It is called the Member Assistance Program. So you will hear me say MAP for short. And um, we are able to utilize this through Serve Kentucky is footing the bill for this benefit this year. It is via America's Service Commission. So this is just a quick presentation, and I will send this out to you after we're done, so you don't have to memorize or take notes or anything. Why am okay. Sorry. Okay, so what is MAP? It is a free 24/7 unlimited telephonic mental health counseling for AmeriCorps members and some of our staff and your household members. And there's other resources as well. I'm going to go through those. You do not have to participate if you don't want to. It's voluntary and it's confidential. There's translation services, and the provider is All One Health. So it includes mental health counseling that is provided by licensed master's level counselors. It's 24/7. It's free short-term counseling. The issues are going to be included, but not limited to that list there. There's also life coaching for personal and professional goals to help with that list there. Life transition, creating better work-life balance, managing multiple projects, living a more purposeful life, improving relationships, setting goals and action steps. Legal assistance. So, legal assistance is going to connect you with a qualified attorney for a free 30-minute consultation. So, it's not unlimited, there is a time limit, and these are going to be that list there is going to be what these folks are qualified to talk about with you. So, if any of these things are something that you're thinking about or you know are coming up and you're just like looking for a little bit of advice to get started, this is a good resource. Financial assistance. If any of these things, again, are on your on your weighing heavy on you and you just need a little bit of help, it's another like the legal assistance is a free 30-minute call. Personal assistant. If you just need somebody to help you manage your everyday tasks, how to get better with anything similar to what's on this list, you can call utilize your Ask benefit, your MAP benefit, and they can help you better plan. They can act as your personal assistant. There are some other work-life resources if you are just trying to navigate some things. A good example is my sister and I tag team helping take care of our 91 and 92-year-old aunt and uncle. They still live in their own house, but they need help as their vision is decreasing and they can't drive anymore. So we have to figure out some transportation for them. And sometimes it can get to be a lot. More things pop up that we don't think about all the time. So um, that might be something that I would use this for. But if you have some issues with pet care or adoption, maybe you have a family member that um, you need some help with or just some advice, this is a good resource to use. If you have some medical advocacy that you're looking for some help with, and you have difficulty trying to navigate and understand our medical care system, which who doesn't, this can be a good resource for you. So how do you access this? So I'm going to leave the link with you when we finish today, and you're going to, I've got the step by step. The password is AmeriCorps. You have to create your login. You can use the QR code to add the app, or you can just access it from your phone or your computer. And there are some resources that you can utilize within the app or the website. So I do want to emphasize here, services are confidential, but in order for you to be able to access these services, if you call on the phone, if you're needing to talk to somebody over the phone, you're going to have to link yourself to AmeriCorps. So you're going to say you're an AmeriCorps member with Kentucky Public Health AmeriCorps at whichever health department that you serve with. So that will be able to unlock all these services for you for free. This is the phone number. So again, you'll have this available to you when I send these materials out to you today. Just another, make sure you got the phone number and emphasizing that it is available to you 24/7, 365, and that is the website. If you have any questions, just reach out to me directly. I'm going to be the best person to kind of troubleshoot if you're not receiving services or if they're telling you that you're not eligible. I'll troubleshoot the best that I can. Any questions about this service or anything I can help with right now? Y'all are so quiet today. Okay. And exit that. We're just gonna keep rolling, y'all. Um, Okay, our next piece on the service on the agenda is Service Year Alliance. This one is going to be a separate email for me, but I just want to give you a heads up. So you're going to be hearing a lot from me over the next couple of days. Service Year Alliance is it's a national program, and they have chosen Kentucky to be a participant. So I'm gonna make sure to make sure I don't miss anything. We have been selected as one of only 5 states to participate this year. So what we're asking for is you to not do anything. You're gonna automatically be enrolled. If you don't want to participate, then I'll send you the link to be unenrolled. But by joining this program, you're joining the AmeriCorps Alum Network, and benefits can include eligibility for awards and fellowships, opportunities to share stories, resources, and professional information specifically selected for national service alums. So, I don't I don't think there's any downside for you joining other than if you are just somebody who doesn't like your information shared, then that might be something that you would want to opt out of. Um, so what I'll do is I'll be sharing your contact information and send you more information about Service Year Alliance in a follow-up email after we finish today. And it will also include that link that says that you don't want to participate. So it's completely up to you if you want to opt out, but the default is that you're opted in. So if you know right away that you don't want to opt in, you can let me know, and I'll make sure that you don't get included. But I don't think there's any downside as an alum. These are things that are available specifically for you because you're National Service alum. And me too, because I'm a National Service alum. Any questions about Service Year Alliance? Okay. All right, next on our list, hard conversations. We're hitting them all today, y'all. Um, this was a resource that was shared by another AmeriCorps program, and I think it's helpful. Um, if I could move things. Hmm, okay, let me try this again. So, because we have we're in the climate that we're in with government shutdowns and political climate that we're in. If you are, okay, sorry, y'all, my thing is frozen. Let me try something else. We had another AmeriCorps program share with us that they had some members reach out to them because they were being asked about their role as being participants in a federally funded program. So they created this kind of helpful flow chart and how to answer if somebody were to say, what is your opinion on this? What's your role in this? So that you don't feel like you're just like, I can't talk about that at all. Um, and it's my computer is just completely frozen now. Um, okay, great. Sorry, y'all. Give me just 1 second. This is what I get for being so prepared for our check-in that it was open for too long and it froze. Okay, I'm gonna skip that and we're gonna go straight to our Kentucky train setup. All right. If you're a returning member, then you should already have a Train Kentucky account. If you are a returning member, can you let me know if you do not have a Train Kentucky account set up? Or even if you're a first year member, you might already have this because your health department has you do a training on Train Kentucky. Okay. Okay. So sounds like at least some of our returning members, okay, Peter, probably don't. Um, Cole has one. So the reason we're talking about Train Kentucky today is because we are coming up on fall and winter season and adverse weather, and there's going to be days that your health department is probably going to close for bad weather. And you have an opportunity you have a choice to either take that day off because your health department is closed, or you can choose to um, do some online training. And your online training is, we need to know that you're actually doing something. So Train Kentucky provides that um, training and certificate for us. So I want to make sure that everybody gets an account set up so that you're not scrambling the day of to get your account set up. But these are free web-based virtual trainings, and you get a certificate, you send that to me, and that way we have a documentation that you completed a training. Or if you already have your certification as a CHW and you need to get some hours, then this is going to be a way that you can get some hours too. Um, so I've gone through this step by step of how to create your account. If you need to create one, um, you're gonna these essentially it's truly is a step by step, and I'm gonna hopefully share my computer screen again. Hopefully we won't freeze. Okay. All right, do you all see the train? Does it say Train Kentucky on your screen? Okay. So this is the link that it's going to take you to where you create your account. But I'm going to log in to my account and show you what I'm looking at. Why I have all these things here. So our group is Kentucky. That's whatever, my phone. Organization. So that's why I have group, employer, organization, department. So there are some things you don't have to fill in, but there's some things that you do. So, obviously I don't have a FEMA student ID number. I don't have a professional organization ID number. So, um, if you have any issues when you're setting these things up, let me know. But that's the things that I went through and I pulled are the ones that require you to put something in. So that's why I have that on here. And then I also included what I felt like what you might search for when you go to the course catalog that would be helpful for you to take. So, any questions about about Train Kentucky? Um, okay, I'm going to try to go back to number 8 here, hard conversations. I really just want to show you all this pretty graphic that got, okay, I think it's going to work now. Is it working? Oh man. Okay, do you all see the pretty graphic? Okay, awesome. All right, so just again, if you are asked a question, then hopefully this will be helpful. Maybe you're not asked a question. I don't know. Nobody has come to me to say that you have been, so this might be completely useless, but it's a good resource to have in your back pocket in case you are. Because if you remember, there are prohibited activities, and we try really hard to stay very nonpartisan in our role as AmeriCorps members. Now, when you take off your AmeriCorps hat, when I take off this AmeriCorps branded shirt, we can be as partisan as we want to be. But as AmeriCorps members, we are nonpartisan, and we want to stay that way so that we can continue to get funded and do what we do and serve our communities. So, if you get asked, what are your thoughts about what's going on with the shutdown or what's going on with politics? You're welcome to say, um, maybe a good option is to say that you stay nonpartisan in your role. Your focus is on serving, and in your case, in my case, that means helping community members access services at their health department. Hopefully that shuts it down. If, sorry, let me make this big. If they ask a question about how you feel about funding or policy changes, you can just say, I can't speak on policy, but I can share what AmeriCorps means here in Louisa or in Louisville or in Benton, wherever you might be. Every day I help people access harm reduction services or WIC or HANDS or access to lead reduction, whatever you're working on. Hopefully that shuts it down. um, any kind of controversial social issues, because there's a lot going on right now. Again, emphasizing that AmeriCorps is nonpartisan by statute. My role is to serve alongside the community. For example, this week I helped a resident of our county access WIC services so she and her baby could be healthy. Or fill in the blank there. I helped a resident access harm reduction services so they could be healthy. Whatever the case may be, whatever you're doing. If you're pressed for your personal opinion and it's a service setting, it's a health department setting, in my AmeriCorps role, I don't take positions on political debates. What I can share is the work I'm doing right now. And if this person does not leave you alone, if none of that is good enough, you can always just say that you're going to send them to me and I'll take care of it. Or send them to your site supervisor, whatever you're comfortable with. It doesn't matter. I'm prohibited from engaging in political conversations. If you have any questions, you're welcome to contact me. There's my contact information. Or again, if you'd rather send them to your site supervisor, that's fine too. Maybe your site supervisor would be happy to not have that conversation. I'm happy and willing to do that. So I'll send this to you in our follow-up email, and you'll have it. You can print it. You can do whatever with it. You can throw it away. Again, if you're not being confronted at all, that's great. It's just a good, hopefully a good resource to have if you ever do need it. I'm gonna go back to our Okay, y'all, that's that. We got through our long to-do list. Does anybody have anything that they wanted to go over, they thought I was going to go over, and I didn't include on the list, or does anybody have any questions? And I promise next month I will not be the one talking at you for the whole time. We'll get in a guest speaker. Okay, y'all, if that's it, then we can wrap it up. I'll hang out for just a minute and let you go 15 minutes early. Thank you all so much for being here. And I'm looking forward to seeing you all on the rest of our site visits. Thank you all.